Hi everyone, today's topic is something very close to my heart, literally and figuratively, because it's about breast cancer. Yeah. Okay, so before I start talking about breast cancer, I just want to use this video, right, to raise awareness about breast cancer and how prevalent it is in women. And also, I'm also quite the feminist. I think that whatever guys do, girls can also do lah. Yeah. So before that, let me share with you some empowering women quotes. Okay, so today's slide is gonna be mostly in pink because breast cancer awareness color is pink. Yeah. So for the empowering women quotes, okay, first one is from Madonna. I'm tough, ambitious, and I know exactly what I want. If that makes me a bitch, that's okay. Okay. Another one is by, I can't really pronounce her name, but yeah, you can read it. So I'm not worried about intimidating men. The type of man who will be intimidated by me is exactly the type of man I have no interest in. Okay, next one by Kamala Harris. No woman should be told that she can't make decisions about her own body. When women's rights are under attack, we fight back. Yep, so I resonate strongly with these quotes that I found. And then let's move on to the main topic, which is cancer awareness about breast. So yeah, in Singapore, cancer accounts for 28% of the deaths in Singapore. So I recently attended a course by Icon Cancer Center, and then some of the details that I took and is in my slide is from Icon Cancer Center. So let me credit this to Icon Cancer Center. And also, I am no expert in breast cancer, just letting you know what I learned recently. Yup. Okay, so these are the top cancers by gender. For male, it's colorectal at 38%, lung at 33%, prostate at 32%. Whereas in females, the cancer is like 70% for breast. And colorectal, 27%, lung, 15%. So you see the difference between a top cancer for male and a top cancer for female is a whooping 32% difference. So since it is so prevalent, women need to make sure that they know of its existence and how common it is and what are the symptoms that will tell you that it's breast cancer lah. Yeah. So I'm here to share. So how do you detect breast cancer? So what the Icon Center propose is what to look out for lah. So this is using the word caution. So it's like a rough guide. So if there's any change in bowel or bladder habits, it's one of the symptoms. A sore that does not heal, unusual bleeding or discharge, thickening or lump in breast or elsewhere, indigestion or difficulty swallowing, obvious change in a wart or mole. Yeah, another thing I want to share is actually some moles can be cancerous. So if you are developing too much moles, right, you need to be wary lah. Yeah. Nagging, cough, or hoarseness. Yep. Okay, so other common symptoms of breast cancer. This is more obvious one lah, like breast lump, lump in the armpit, changes in the shape and or symmetry of the breast, skin irritation, like you keep having rash on your breast, dimpling of skin, redness or flaky skin, nipple retraction. This one very obvious because there's a growth, right? Then your nipple retract inside because the growth grow bigger than your nipple lah. Yeah. Nipple discharge or bleeding, pain in the breast. Yeah. So these symptoms can also happen when you don't really have breast cancer lah. So important to get it checked out early. Yeah, and don't want to nag, but if you're getting it checked out, please buy your insurance early. Okay. Then factors affecting breast cancer. So technically there are some risk factors that can affect cancer that you can actually take note of. So it's if you have a sedentary lifestyle or obesity, too much alcohol, smoking, and you have been taking hormone pills, those kind of morning after pill or those kind of contraceptive pills, all these are factors that will increase your risk of breast cancer, and also like diet lah. Yeah, diet, later I will share more about what kind of diet will affect breast cancer. Okay, so some risks that you cannot change lah, because technically no one can reverse age. Then family history, you can't change that. Then also early menarche. What does menarche mean? Menarche means like the earlier you get your menstruation lah. So they say if you get your menstruation before 12, is considered as early menarche. So I'm one of them who got it before 12. Yeah, okay. Then late menopause also will lead to higher chance of breast cancer. So actually I don't agree that non-modifier factor is childbearing, because you can choose when to have a child. So yeah, this should be under the modifiable risk factor. So having a child will help decrease the risk of breast cancer. Okay, so another one is exposure to radiation. Okay, so what can you do to help prevent breast cancer? So top thing is exercise. Do not drink alcohol or drink in moderation. Quit smoking. Keep a healthy weight. So basically, just now I talked about the factors, right? Just all the opposite lah. Yeah. Discuss hormone replacement therapy with a doctor. So instead of taking the contraceptive pills, you do hormone replacement therapy instead. Yeah. So rough guide about how much activity you need. So 150 minutes per week. Then for muscle, that's for like HIIT lah. Then muscle strengthening should be at least 2 days a week. So honestly, for myself, I don't think I achieved this. I will try. So start with 5 minutes every day lah. Yeah, but anyway, I'm injured recently, so I can't do this. Okay, I will start doing it when I recover. Okay, so this is about the diet part. So what is food that will lead to higher risk of breast cancer? Okay, consumption of red and processed meat, sugar, sweetened drinks, bubble tea, all this. Me lah, I also drink a lot of bubble tea. Okay, alcohol consumption. Currently, I don't really drink a lot, so I think that's fine for me. Don't use supplements for cancer prevention. So don't use that kind of cancer prevention supplements. For mothers, please breastfeed your baby if you can. And after a cancer diagnosis, need to follow the recommendations by the doctor lah. Yeah. So what other food is like fast food, high in fat, which I like actually, starch and sugar. So you should be eating a diet rich in like whole grains, vegetables, fruits and beans. Well, I eat vegetables and fruits. Beans I also eat. Technically I eat everything, but whole grains maybe not so much. Yeah. So be physically active. Yes, I try to be a healthy weight. So currently actually I'm a bit underweight, but I don't know, I think still okay, right? They never say underweight is part of the risk factor. Yeah. Okay, so they also say avoiding exposure to tobacco, because tobacco will lead to like the cells anyhow grow lah. Yeah. Okay, so some examples from the clinic about cancer patients breast cancer patients. So there's this woman, had 55 years old, already finished her menstruation, like postmenopausal, got breast cancer at stage 2, then HER2 negative, so she underwent treatment with a curative surgery, meaning chemotherapy and hormone treatment. Then she went back to her normal lifestyle. Now she can still continue her work, even going for a vacation for the next year lah. Yeah, so it's then let me contrast it with example B. So there's this other woman, she's 42 years old, so it's also before she got her menopause. She had a breast lump and refused to have treatment. Then she went to seek help from like TCM doctors, but even the TCM doctors couldn't help her lah. So the TCM doctor also told her to get the medical attention from the western side, but she refused lah. So not long after, she came into the hospital with acute shortness of breath, and then it was discovered that she had widespread metastatic disease to the liver, lung and bone from the breast cancer lah. So it spread to the rest of her body, and then because she refused to get treatment. She missed the window for treatment and she passed on shortly after. So her biopsy results show that hers is a HER2 positive disease, which is like actually highly treatable. I don't really know what is this HER2 negative or positive, but yeah, okay. So for this, right, moral of the story is do frequent checks and get treatment early. So do frequent checks only after you get your insurance and get treatment early. Yep. Okay, so how do you detect breast cancer? There are two ways, through ultrasound and mammography. So usually, even if mammography is fine, doesn't mean that ultrasound is fine. So best if you can do both. Yeah. Okay, so some of the treatments for breast cancer. For advanced cancer, it's recommended to do mastectomy. So it's like something like removing of the whole breast or the partial of the breast. Yeah. So this one is more relevant for like older people who don't need to have children anymore. Yeah. But it also depends on the stage of the cancer. So like if it's early stage cancer, you can still do removal of the tumor with margin of healthy breast tissue. So after that, because you didn't eat, maybe they don't know that the cancer spread to the other part. So need to do a post-op radiotherapy to reduce the cancer recurrence. Yeah, so this is for early stage cancer. And then another kind is when like very small lumps are found. Okay, so it's called clustered microcalcification. So for this, right, basically a radioactive substance is injected into the place, and then the area is identified and allows like a probe to be accurately go in and accurately remove these clustered microcalcifications. Yeah. Then lastly is using some of this technology and like also have breast conserving surgery. So do a wide margin excision, then still also cover it up with like some plastic, so aesthetically produce a breast shape that closely approximates a normal breast. So for late stage breast cancer, late stage means spread to the other parts of the body, only got these few treatment options: chemotherapy, hormone therapy, targeted therapy, and radiation therapy. Yep. Then this graph shows the improved survival rates over the years because medicine has become more advanced. But also like the incidence of breast cancer has gone up. Yeah. So for population of women below 40 years old, in the western side, breast cancer accounts for 47% of breast cancer below 40. Whereas in our Asian population in Singapore, the number is higher, so 19% of breast cancer were aged 44 years and below. Yeah. So the treatment does not differ from that of older women, but also must give consideration to the numerous psychosocial issues that these young women will face. Yep, so cancers in young women usually larger, more aggressive, diagnosed later. So treatment depends on the stage, and systemic treatment does not differ, but there are some considerations like whether you want to retain the breast because like haven't had kids or whatever. Yeah. So in addition to this psychosocial issue, need to consider family history, whether it has a hereditary breast cancer, so fertility issues such as the egg or embryo cryopreservation. Okay, so like usually these women are like young and then they have families, maybe with or without kids, at the peak of their career, trying to juggle between work and the young family. So maybe have loans because if young and just started work. So also like if you cut off your whole breast, you have like peer pressure like, hey, why do you have boobs, like that kind of thing. Yeah. I mean, definitely people will not say that in your face but there will be definitely peer pressure to retain some part of your breast. And then other things like sexuality, fertility, and relationship issues body image, and so also like worry about like whether your siblings have this kind of disease, because if you have, it means that your family members are more likely to get it also Yeah, because you all have the same genetic workup. Yep. So some of the things that they recommend is a hormonal treatment. So addition of ovarian suppression. So it means that like it might affect your fertility in future lah. It's an induction of early menopause. Then we'll experience more side effects like hot flushes, mood change, depression, insomnia, weight gain, and osteoporosis. So other financial aspects that you need to think of is employment, because like technically when you have cancer you'll be very flustered lah. You want to still continue working, you know. Yeah. Then if you don't have a critical illness plan, you will probably need to continue working lah. But with a critical illness plan, you have a choice whether to continue working and then maybe enjoy the time you have, or try to recover with the time you have lah. Yeah. So like taking care of young family, also a potential source of added stress. So as you know, stress will actually contribute to cancer becoming more aggressive lah. Yeah. Then there's also a need for psychosocial support, family support, peer support. Yeah. So fertility preservation, why is it important? It improves the survival of early stage breast cancer patients, and important to ensure that these survivors have a good quality of life and then able to pick up their lives from before the diagnosis, able to look forward to a fulfilling life, getting married and having kids. Okay, so because younger survivors have many years ahead of them lah. Okay, so these are some of the common questions that people ask when they have breast cancer. So all these need to go through a thorough assessment by a gynecologist. Then another thing about embryo preservation, I think under the Singapore law you need to be married to have embryo preservation. Yeah, so all these need to be considered lah when you are receiving treatment for breast cancer. Okay, so not say only normal women that don't have kids have cancer. So even in pregnant women, breast cancer can be found. So it's like 3.7 cancers diagnosed prenatally per 100,000 deliveries. Yeah, so like pregnancies may be complicated by cancer. There are approximately 1 in 5 breast cancer in women ages 25 to 29 is diagnosed either during pregnancy or during the first postpartum year. So really, breast cancer is very common in females. Yeah. So about receiving cancer care during pregnancy, so there's risk to the fetus, risk to the mother, and then other factors lah. Yup. So basically, these are some of the approach that they will take during the first trimester. There'll be radiotherapy and try to do breast surgery. So basically, breast surgery can be done throughout the entire pregnancy process, and sentinel lymph node biopsy. Yeah. But then for chemotherapy, because need to wait for the baby to stabilize, so chemotherapy only from second trimester onwards. Then after the delivery, can continue on with the radiotherapy and other kinds of therapy. Yep. Yeah, so this is an example of one pregnant woman diagnosed with breast cancer at 37 years old. So keep feeling pins and needles sensation in a lump on her left breast. Then formed in 2018 when she stopped breastfeeding. So this article was published in October 9, 2021, recently. So 2 weeks later, found out she had breast cancer. And once you hear like cancer, your whole world stops lah. Yeah. So also found out she was 4 weeks pregnant, then had to go through radiotherapy during pregnancy. Chemotherapy, yeah. Yeah. So also like, because your hair will fall out during the chemotherapy. So yeah, very saddening thing lah. Better be aware, treat it early. So after you treat it early and then you want to go ahead and have kids, you can still go ahead and have kids lah. Yeah. Okay, some ending thoughts. It's really such a heavy topic, and then like breast cancer really very common lah. yeah, a lot of people think like young they will never get it, but then there's really so many people around that have breast cancer already. That's why there was this breast cancer movement. Yeah, but obviously people who will see it will think like, oh, it will never be me, but seriously, it can be anyone. Okay, just want to share this article. So women in 30s facing breast cancer, so of any age you can get breast cancer. So she's very healthy, avid cyclist, run, does yoga, then found a lump lah. Then after that she went like for tests and scans, then came a diagnosis. She had breast cancer. So it's like really a shocking thing lah to receive at 30 plus years old that you have cancer, and especially for the breast, because like for women, breast is like sometimes what guys look at the most of the time lah. Yeah. Okay. And then so here have been mentioned 16.3% female breast cancer patient diagnosed below the age of 40. Okay, so the thing about this is really it can happen at any time, so need to be aware of the how to detect it and then get treatment early lah. Yeah, so also like I mentioned, family planning important consideration lah for people who are diagnosed with breast cancer. Yep, so if you want to read this article, you can go and search it on CNA. Also, definitely when you have cancer, you need to pay for medical expenses, so came up to nearly 50k lah. So that's what you can expect if you get diagnosed with breast cancer. So better make sure that you are covered with hospitalization insurance and critical illness insurance. Yep. Also, a lot of women think that they don't need to go for scan because no history of cancer in the family and they feel absolutely fine. So the thing about this history or not, right, because of the food that we eat, and now cancer is more common than compared to last time. So better make sure you do your checks, and before you do your checks, please buy your insurance. Yeah. Okay, so I hope this video has improved your knowledge on breast cancer, and then it has helped you to be more like aware of what breast cancer is about, so you're not like lost when if it actually happens lah. Okay, so how you can support breast cancer awareness this October, just nice, you can, yeah, that's why I'm promoting this video this October. Okay, breast cancer awareness, so head to your social media to talk about breast cancer, and then just to create awareness lah. Yep. Okay, the second point is to buy limited edition pink products, but this one maybe okay, if it's to raise funds, then it's reasonable. But anyway, it's pink, so I guess it's fine. Yeah, so all this pink stuff, I don't know whether really go to the cancer fund, but sure. Okay, then another one is to join the breast cancer run. Okay, move for pink. Okay, I like move for pink because I love pink. Yep. Okay, thank you everyone for watching this video. I hope this video has helped you. If it has, please like and subscribe. Thank you everyone. Bye bye.